So the first thing we do is we want to start with using the extremities, the legs. So this is using our QRA, quick relief acupuncture technique and system, acupuncture system on how we treat diabetes. So most of the time, diabetes is always a digestive problem. And so the two main organs that affect the digestion in Chinese medicine is the spleen and stomach. And so that's why we like to use the spleen nerve to treat, to help the pancreas function better, also to help the digestive system function better. And so we use, we may use, you can use like spleen 6 all the way to spleen 9. Those are the common points that we use. So I'll start with spleen 6 because Vanessa also today just so happens to have a temporal headache, and when we treat the temporal headache, we focus the needles on this area of the leg. And so part of our QRA system, we don't actually use points, we use imaging. So it's all about imaging different parts, using different parts of the body to image other parts of the body. So we're using her leg, her foot down, her whole leg, this is her lower leg. We're using her lower leg to image her digestive system and also image her temporal part of her head at the same time, so we can hit two birds with one stone. So the digestive system, in our imaging concept, the knees are at the level of the digestive, in the stomach area, the umbilicus area. Okay, so this area just so happens to be the gut area, where all the intestines, the spleen, pancreas, they're all within this area right here. And then when we're using this area to image, this leg to image the head, the knees are at the level of the eyes, so the temporal area just is also in this area. So we can hit two birds with one stone. Alright, so let's start. Okay, so I've done this along the spleen nerve, and typically for diabetic patients we do it on both sides, so I'll do it on the other side too. Okay, so this will address the spleen function, this will address the stomach function, and it can also help with absorption, so in the gut, better absorption in the gut. Okay. Now another common diagnosis or root cause of diabetes, it's not always just the gut itself. So we find also that the kidneys are involved, right? And so the kidney nerve obviously runs down here, okay, and so we can also use if we're using the whole leg and we're imaging and we're trying to find the image for the kidneys, then this part, this part is here, let me show you. So the kidneys are right in this area right here, right? Our kidneys are usually back right here. So it's at the same level. If we draw a line all across our body, it's still at the same level of the umbilicus and the GI, the gut area, right? Where just so happens to be, your spleen is about right here and your pancreas about right here. So the kidneys are almost at the same level. So when it's at the same level, when we're imaging the leg, using the leg to image this abdominal area, it's actually the same area where we would stick the needles, right? So let's go back to Vanessa's legs. Let's see, go ahead and get a zoom in, there we go. So it's the same area, so we've already picked the location of where we need to insert the needles. Now we want to pick this basically the specific, even narrow it down even more. We know we just need to stick needles in between here because the kidneys are imaged in this area too. And it just so happens the kidney nerve passes down here, right? So we'll just do some kidney points. Okay, I'll do one down here. So usually I'll do a few more, in the kidneys. Okay, so this can help the kidney function, which is going to help the water metabolism. It's also going to help electrolyte balance, which all affects blood sugar. So this is some of the points. So if your diagnosis, whatever diagnostic technique you use, you get a TCM diagnosis first. Then you use the acupuncture to address that diagnosis. So if it's a spleen or a stomach dysfunction, we can use the spleen nerve to treat both the spleen and stomach dysfunction. And if there is a water metabolism issue, which most diabetics do have, then we're thinking about kidney and bladder, right? And so the kidney area, we put needles along the kidney nerve, and the kidney nerve can also treat the bladder. And so this is how a couple of ways that we treat with acupuncture diabetes. And one thing that you can do is to see if what you did actually worked is, for example, I could have just put the spleen needles here, okay? And then so before you do any treatments, I would have the patient test their blood sugar. So tell them to bring their glucometer. So test their blood sugar before the treatment. You stick these needles in, and usually we do about probably 10 needles on both on the legs. We use a lot of needles because it does take a lot of small stimulations to induce the result. And the result is this: you have them test their blood sugar before they do the treatment, and then you put their needles in, and then have them test their blood sugar right after, like seconds, like right after, directly after, okay? And it should drop it. If you put the needles in the right place, it should start lowering the blood sugar because it's improving the absorption of the glucose into the cells. All right? How's your headache?
It was gone with the first 6.
It was gone in the first 6? So her temporal headache was gone with the spleen needles, or just the first 6 needles, right? So as you can see, you can hit multiple birds with one stone if you know exactly where to put the needles. And our QRA system is so simple that you don't even really need to know the points, because these aren't really points. I mean, besides spleen 9, they're not really points. They're just areas of where to put the needles. And so our QRA system is based off of areas of where you put the needles and not necessarily acupuncture points. Okay?